Hi everyone, welcome to the Her Sacred Place channel. Today we will be discussing bacterial vaginosis, commonly known as BV. If you haven't already, make sure to like this video and hit the notification bell so you will be notified each and every time I upload a new video. Alrighty then, let's talk bacterial vaginosis. Bacterial vaginosis is a condition that typically occurs in sexually active women and not considered an STD. It is not a true bacterial infection, but rather an imbalance of bacteria that are normally present in the vagina. It is the most common cause of abnormal vaginal symptoms in women ages 15 to 44. However, women who have not had vaginal, oral, or anal sex can still be affected by BV, as can pregnant women and women who have never been pregnant before. To diagnose BV, the doctor may use a vaginal pH test or a whiff test. A vaginal pH of 4.5 or higher is a sign of bacterial vaginosis. Normal vaginal pH is between 3.8 and 4.5. Researchers do not know the exact cause of BV or how some women get it. However, it is believed a type of bacteria called lactobacillus and others keep your vagina slightly acidic so bad bacteria doesn't grow well. If these levels drop, more bad bacteria is able to move in, resulting in BV. Since lactobacillus is commonly found in yogurt products, some believe eating yogurt keeps BV away. Also, the IUD birth control device, which fits inside of your uterus, has been linked to BV, especially if you have irregular bleeding, but it isn't clear whether this is a direct cause. Lastly, about 1 in 4 pregnant women get BV often. The risk for BV is higher for pregnant women because of the hormonal changes that happen during pregnancy. Many women with BV does not have any symptoms. Actually, up to 85% of women who have been found to have BV are asymptomatic. If you do have symptoms, you may notice a thin white or gray vaginal discharge, pain, itching, or burning in the vagina, a strong fish-like odor, especially after sex, burning while urinating, and or itching around the outside of the vagina. BV will sometimes go away without any treatment, but if you have symptoms of BV, you should be checked and treated immediately. It is important that you take all of the medicine prescribed to you, even if your symptoms go away. A healthcare provider can treat BV with antibiotics and or creams, but BV may return even after treatment. It is important to note that cream suppositories may weaken latex condoms during treatment and for the last 3 days after you stop using the cream. Doctors and scientists do not completely understand how BV spreads, so there are no known best ways to prevent it. The following basic prevention steps may help lower your risk of developing BV, however. The first one is not having sex. As stated earlier, it is believed sex increases the risk of BV. Secondly, limiting your number of sex partners. Women with multiple sex partners seem to have an increased risk of developing BV. Thirdly, definitely and always, you probably hear me say this all the time in many videos, never ever douche. Douching is very harmful to the vagina and can disrupt the vagina's natural pH. By the way, douching to get rid of BV or the symptoms of BV is a bad idea. Douching may actually make it worse by pushing the bad bacteria further into your uterus or fallopian tubes and creating other problems long term. Also, make sure to always use condoms. It's always important to use condoms during sex for many reasons. If you want me to do a video on condom use or anything else, feel free to drop it in the comments below. Lastly, as you probably have heard me say many times, especially when we were talking about the tampon video, do not use any scented feminine hygiene products. This includes soap, bubble bath, menstrual pads, tampons, or anything. Always go for the all-natural products. Majority of the women who come into Her Sacred Place with vaginal odor have suffered from BV in the past and know the smell of it all too well. I always recommend visiting a doctor to diagnose the infection and make sure the abnormalities are not coming from something else such as an STD. Most commonly, these women have tried natural remedies they have researched themselves, such as eating or placing yogurt into the vagina, using boric acid capsules, taking apple cider vinegar sitz baths, and or inserting a blend of all natural oils in the vagina. While some of these holistic remedies work for some women, others they do not work. So, it is important to visit a doctor and begin a recommended treatment plan from a medical professional. When it comes to steaming for BV, it is important to know whether the client thinks she has BV, simply has vaginal odor, or currently have an active BV infection. If she is just feeling off balance and thinks something is wrong, the symptoms usually go away after steaming using the hersacredplace rebalancing herbal steaming blend. However, this is not the case with active BV infections. It takes multiple steams over the course of days in order for the vaginal steaming to help with an active infection. I always consult with clients when they may be experiencing BV to give them the best recommendation on steaming. If you enjoyed this short video on bacterial vaginosis, if you like this video, please be sure to give it a thumbs up and hit the notification bell so you will be notified each and every time I upload a new video. Leave a comment below if there are any topics you would like for me to discuss in the next video. Until next time, happy steaming!